Foi a fala eu, sal pisa, sal pau, wa fio tupu, te bali. A o to uli foi pona o lato te pui pui. Ta mama ci da la tudu. We bu fai bolato tofi, mauta bolunga al fono fai tu la fono ma lo America Samoa. E wa fio bai. A malor so fua. Mele la fio gal prestede. Fio foi le fio gal sui prestede. Malu te bala tu a fio ga sento. Se tatu atu ia bobua. I lumo le atua. A walon fatasi mai. Ma futaina lo to babalu. Ono i lei fa mo taua. Mo sio tatu atu do. Su mai foi o tatu bolbau. Su ai fa tonu ya Sandra King Young ia malona. Soa. Ai la saudia si te talo. Ola amatalia ele o tatu. Ilo ilonga. Lea tuai. E ofo lava i bātou lo walofa bla wanga lelei. Ua vaia toe mafuta o lau whanau le tai au. Lau whanau e o tau matua ina. We o tau o ta mā o le atunu. We o tau o tupu bae whale atunu. We o whamauria na ofo ina atu lo lato soifua. Mai yaso uma matausanga uma le soifua. I ainga o nuu. Le tu malo o le malo. Ai maise lau fi au mlango aduenga. Awana oe. La sia mo o ile tu langa le soifuanga. O fila ngalo iai la o fio. La tau te hafi fio le maota nei. O afua na. Mul mawida ai le soifua ofo inatu. Whaftai le tua le te tai au. Soifua o onda nei. Fua loa soifua. Alo e whaonga ina pia. Whaftai a inga o mafu ai o nuu mafu anga pe o le fili ngalo iai me se foi so bato balo faftai le tua i lo mafu ta bai blo so swai bai le malo America Samoa me se foi kovana au tau pule me se foi lai tua o le ta lai bel lai tua sui ia me se foi vaenga fa msinonga ia manuia malo America Samoa masi o mo to atu du lau whana o atu o lavai se o pito i titi i lau tau siga malo o lofa le bavai watasi bai ndei wha mboe a whaia i ta maia mato mo wai mea lilei o mea lilo mea lofa lilo a o whafonga le malo le atu du whamanui atu i ate i lato whamanui fwoi mato bolba o mato mafuta ne tai mato mo foi so swali lei mai ai la u au ale manui o mato trat ilo swafa Yesu amen ya o te mai lu vole tua tato tau laga le tai au ai o te whaatalo watu li whaatalo whalau a fioga whaatol sili Sandra King Young, ia ma lo 5 tau. Le tai au fō, whai au masui o ta maia, e ma malu se nate, o le mao ta maurunga le malo a Brik Samoa, ta maia o le atudu. Ua, me se manatu wha pei ta maia, ma na ia tele proklama o whea gaima, ma lau, o ti nā, tu whitfo e Sandra, wha mau nia lau el ma na ia proklama o ngai, whanau, oi, tangata uma le atudu, o se o lava i tātou whanau. O le bēleo lo fia papalama, ia ire, tātou bot, tūlanga le la, o ia ire la, tu e amatania lau, le proklama wa sa tāpunia, o le sa whaare tonu tupe, e fia wha, fonga la malu le mot, I lau amatanga fōu. It's a new beginning, it's just about to begin your program for referring patients of violence. So we'll give you the time to tell the Senate about your new beginning. Any changes, any improvements, especially the money. Is it going to be, are we going to run out or along the way? Me leo te rawa tuai whalalo sei sau do mai o mole sukan whato ia na o wholele awa noi malu o tō ta bāna suru ia mo nei whisiri ma tātou talta noa I nim tau tāua ia Sandra?
E tai pēr ia le pa ia whaata whao maota I le a senatoa o ta mao le atunu. Ma lo soifua manuia I la wafionga tai committee, o le soifua malolo ina la wafionga le senatoa tu ia lau moli male mamalu o committee. Ma lo a fua ai lau ua maua. Whaftai ua wala au ina a uma siau soa o le tō whaia tua lau vau Austin Asiata e whai masui o le matou ofisa e tali. Ma whaamalama ina, nisi o mata upo lo fina ngalo ai o tō wafionga e whaamanino. E sa o lava lau saunuanga la wafionga senatoa e a mata il vai aso fōu o na tō te talaina le bloka lama e ta ua e matou o referral services. O services I whai I whafo atu o le LBJ ma le Department of Health. O te whawhitai atu fōi ona ua pāsia, ono lo o tō wanga leile matou pāketi mo le tausanga fōu, o te manatu le nei ono miliona ua tu umai matou ofisa, e lava matutoe e whai ai ma whaatino ai le matou ngaluenga le tausanga fōu, whawhitai lava.
Ia, o tuatu lava loa, te bā, peo kai sentoa, malu ia malai siri, ia, lawa fionga sentoa, malai pule, sau do ia.
After actually, lawa fionga te komit, pa ia fo il mota le taio, sua tu fionga sentoa, a mese te taio il mota, ale, me mumua lawa fionga te komiti, ia, ole nganga whaktai le taio, maula wano tātou te sila whai ai ma le sunga whatonu. Ole me I lo langona le taio ia e ala toese langona tātou maftanga. O le ua umana mo lo sunga le whatonu ma lo ofisa. Mo umana whaale le whingalo mota. I safta pai o le tupe mo le whaanga I o inga le ofisa. Pa ole mātou talo I sa inga le whionga le kovana le I le pakeki. I o le mauti noa le ua whai tātou whamtalanga I lungo o le me whaatino I le ngalue ngalo ofisa ma. Pa wat whautuanga e watu I le sunga le whatonu. O le me le lei mo au, le whionga sentoa, o le lei mo tai o le atunu, I le lei mo tangata uma. O le winga lau whamtalanga, I e whai lea mi o tonu le proklama pēr whapea e whatau nuu I e whaiwa matuta. A wafoi le whapito manu I atasi. A e langu tasia le atunu, langal whingalo ngal mota ma fuae ni tau whai e pui le le se lengi le ongo midonga le avatu le matching fund lo office o tau tuaini o le atunu a tau nu foi o le sao na nei no fo inga to le tfun malvalo ia mo le tato o tunu e mātou te lei tu uol mota ma le tau sanga fai unga luenga le tau sanga o la ula talo le avatu ia tarusia a whapeo taha te whale ka wala whingaro le whionga le kovana ma mo seingi pake ia ona le lei leo mātou whamtalanga whai atu a pal meu tawa wa umana ta oto le whingaro le mauta i la whio atu to mai o le atunu e le tupe mo le masin whana mo le ofisa paula la talo le vatu ia whaatino ta whapeo mai on whatanu ia whaatino ngā luenga atangi ai le tina ngalo mauta whaatino la meo tonu whai lea meo saa mo tangata ia mātou te talo fo i o whai e leila wa se whai wai asa ma se mau mau e i wha le tonu al mātou te nunga le ua watu atoa whatu tuanga al mauta e ale lonu finangalo pasi ai le ono miliona le watu mo le ofisa ia o se au nā whau tuanga le tai au ia paul me talo ia a whapeo o se ingi le whionga li kovana ia ona na i leo fua mātou whamtalanga ma sau nuanga al mauta al finangalo na al mauta umonta oto i whaatino ai le ofisa paula u whau tuanga ia whai la me tonu ma la me sao tau whai whaatino i ngā luenga mo tātua no after atu lo whionga tate komiti mo la no
tai tele la whionga sentua pole saudoanga mata ko fie
Aftai.
tai saudoa ia lo pera padoi pa palu le bota ia la whionga si presidente
atu lo whionga tate komiti tal tongu na usa no tu le whionga sentua ia mlai pule o matu manatu fo ina le wo fai le tatu ma duenga e ape le ongo milionga i tu tonu ina ia matcha i proklama o tom fai tu fingi pontina ia Sandra King pa o alfa moe moe a fai sengi lor kovana ia wo uma o tau lau tatu fa moe moe o tau nu fo mela e mana o yale officer ina il lava se matching fund e avele atu nu oro sa i mai fafu ia o la ula na susun ili tu iso mato vasili e vatu fa malo mal faftai ili ni tau o le fa fongo mai te mai taile ia a pasilo le pa ke ku lua su lim ia msalo ma o mamlai pule mo tu e fangi ma na ma o e mai tu ma o ili primary doctor li ma ke fio mo specialist o pa uma tanga te e ma fangi a vino fa tai mo no la
tai saudoa la whionga si presidente la whionga se toa la whionga so viola roia fioga
Mitia ao motor ni tai au ma lor so fua ole pesidi mumua ua fata oto so to fuanga mo le faonga ina o tupelea o a mea o le a whaonga iai. Le polenga le ia tea. E watu nei fo le tupe leo na alu le administration. Whanga i o inga o tau ma te tongi ai e te tongi. Ai le alu i mai. Le tongina o pili a mai. O manatu le au te le tupe. Ai o le ale fuafuanga ua fata ona. E whaaru i le tupe lea.
Whaftai lava i la wafionga mo le fisili. Ma nai le fisili, a wai tele o tūlanga o le whaatino ino o le ngaluenga le Medicaid. Ele o malamalama tele e le atunu. O le memo mua lava e te tau ona o wha malamalama ina. Pei ona o tau sila fia i le matou pāketi. Lea na whaaulu atu i le whono. E toa lua whaingo o le pāketi a le ofisa o le Medicaid. Ma o le tūla whono a le Referral, e le mawhai e mātou o na whaongasi se tupe. O le vaenga mua, o le tupe lea i le tausanga, o le whaatupe lea o le lua lima. O le a maua le matou ofisa le selau 2 miliona, o le tupe o le Referral. Pau lava le tupe o le tātou loto i whale o le ua maua e wha match ai le tupe le nei o le 1 milionga. O le 1 milionga le nei e le mawhai e mātou o na whai e se mea ese pau lava o le whaonga mo whaamai o tātou tangata. It is very clear in the law and how we operate the program. The 6 million is only for medical care. We cannot use it for administration. Ai sea, o lana ua manino ma ua whaatulanga ina to toa o tula fono federale I whaonga ingo tupe ngai ma le local match. We cannot pay any medical bills unless the local match is paid first. Only we use the 6 million, the local match first, if we get an invoice, for example, for hotel accommodations, for transportation or medical care. We first have to make sure we pay them the local match, then we're able to draw the federal share. That's the first part, is how the 6 million will be used. O le paketi o le whaatino ele ngā luenga o le mātou o lava ofisa, le tutongi ina o le mātou au whai ngā luenga, le whaatau wina o mātou equipment e whao ngā, ta vale o travel, administrative costs, o lo o iei le mātou paketi, ngā le tasi ma le 2 miliona o le mātou administration costs. O le paketi ngā o le administration is matched at 50% federal and 50% local, which means we also need 1.2 million in local funds to fully draw down the 1.2 million in federal for our administration budget. But o le tupe ua avangoa mai mo le nei tausanga, whawhitail malo ua whaisesi I tanga la ititi o le valu sela wafe. So le tupe o le federale for administration is 1.2 million, out le tupe le local match tau iai le tupe le federal is 800,000. So ele o ato atoa le local match al mako al administration. But we cannot use the 6 million. That is specifically reserved for medical care only. So
on the ratio la le matching or the matching total administrative costs limas full percent le America Samoa limas full percent el federal.
O le alava.
O le ale matching ratio ile tau o le medical care.
O le medical care o le taimi nei o le onos fuluvalu pesene le tupe le malo tele e tolus fululua pesene le tato tupe lo to ifale mo le matching. So it's 68% federal and 32% local.
O ana fento e alua I lalo le ratio le ia o lunga fasu lima listeni.
I le tausanga o le Affordable Care Act na mauai se itanga la ititi o le this 6832 o le maasani sa 50-50 sa 50-50 yasola pasia lo le Affordable Care Act nga mai lo le si itanga la ititi lava mo le local fo inga nga si ai lo le federal le 55 and 45
Octero ese mai le ofisa o le ratio na lo iai
yes.
lima wharima.
Yes.
Ona whena sui ai.
It was passed in, let me see, in the year that we received the FY 2020. Na CEI le percentage le lea la o manui ai tato o CEI lunga le vaenga e sawa le federal le ongo valu pasenge ai tolu lua ia le tato tupe lo to ifali.
A whaila o le ratio na iai e taulan o vatul tupe e mwhai onga match mai le federal I le selauma 2 miliona ele saole.
I'm sorry.
E tauna a whai e vatu le 1 miliona lea awa le tu sa e a fo I a fua le onos fulu valu le federal todos fulu o no ingal todos fulu 2%. E taun o vatu le il tupe mo mai le fe. Il federal le whaanga ina le 1 miliona le match.
O le alava.
Okay. So a whaila o tulanga lea o le au iai awa a watu nei le tupe loto I whale whaonga mumua. Ona umale wa te tongi pidi ele a mai, tangata ale ngase. Ia ona whaangalo leo le mea nai awe i o e trauma i ele tupe. E whaangai le ratio le tolus fulua tā la, tātou e maua mai le onus fulvalu tā la le federal, sa.
O lea lava.
A maua mai la le onus fulvalu na tā la le federal o fe awe i ai. Wa le ua umana tongi pidi al mai.
O le whainga o le tutongi ingo pili. A whape maua mai se invoice, se pili mai Hawaii po New Zealand. E vai lua e mato ofisa ma le treasury le tutongi ingo pili. So for example, o le se pili e tasi afe. Yeah, 680 is paid for by the federal, and the other 320 is paid for by local. We cut 2 checks.
How do you do that if you have not received the money until you spend the local money? How do you split that bill already when you have not received the funds?
We receive the funds when we submit the vouchers. Every time we submit a voucher, nga draw mai lola I le treasury. They can do that every week. So it depends on I submit a le voucher la wo fa manino le lava le share le federal ma le share le local. Yeah, draw my lo treasury le tupe lava le taimi lava na, and then they cut 2 checks. They cut a check from the grant account and they cut a check from the local account. E lua la siake ave New Zealand pe ave Hawaii.
The two separate
checks.
Fund maintenance and accounts is still maintained today.
Yes, it's still maintained, and we are in very good. We have no. We have not. We do have some debt that's still left that we hope to clear next week. But we have been able to protect our credit with our providers by working closely with them and giving them assurances of payment.
So when you shut down the program and not paying any more bills, what happened there?
Okay, thank you.
Were we just totally without local funds?
And I really would like to take some time to explain what happened. Ia mati, sai loa lava mato ofisa, afa apea e manao lava le atunu e faa wau pea le tautua o le ofisa le Medicaid le tūlanga mo oai. 2023, FY 2023, when 23-24. We knew we had asked, we didn't get the budget that we had hoped for. So we knew that the only budget, if we continued services the way we were continuing, that we would run out of money within the first 6 months of the year, of fiscal year 2024, which was we suspended referral service. Wait.
You're talking about fiscal year 23-24.
I believe whatever fiscal year we're in right now, 24, fiscal year 24.
Well, you said in March of 2023.
Sorry, so I meant March of 2024. March of 2024. I misspoke.
Okay.
March of 2024 of this year was when we suspended referral services. This is important to understand. Ele tau fiel matu tau tua ele tatu fale mai ma le Department of Health. Ai sa yai lava le tupe. The way the referral works, alu se mai e fai se tonga fitinga I fafo. It takes months for the bills to come in. They don't all come in at one time. So sa yai lava le tupe loto I fale ya mati. But sa malamalama matu officer o lai se lau tangata lai ngusila. E lai le yo o mai o lato pili. I lesi ono masino tutoe le tausanga fa tupe nei. We had to reserve that money e tutonye yo lato pili. Because if we didn't, we would have been in big trouble. And that's what we did. As soon as we suspended any new referrals, we reserved that money knowing and understanding that the bills were coming due. Because when we refer a person, we have to ask New Zealand, how much is this going to cost? What is the estimate? And they'll say, this is going to cost $100,000 and it'll take 2 months. They'll have to be in New Zealand for 2 months. So we forecast that. We forecast that and say, we reserve the $100,000 for patient A. So we know that if we don't reserve this, we're going to end up running out of money and then owing money because we did not do our job to reserve the money. So we have been able to pay off most all of our debts, and it's a complex management of finances and forecasting that our finance office, and I apologize that my division head finance, she's at another government function, wasn't able to be here today.
Yeah, it would have helped if you folks had explained all that to the people and the country, because the only word that we got is you suspended Medicaid. So that comes with very serious connotations. What we're looking for now is how are you going to be utilizing this money? The big concern for a lot of people is the LBJ, when they make referrals to Hawaii, they only pay for airfare. What's going to happen? Will Medicaid now apply to referrals to the state of Hawaii? Because that's our next urban center for this country.
Yes.
Because we're not qualified to be the urban center for this grant as well. Is that correct?
That is correct.
Okay. Ole o mai o ngase la ia ole a toe ave I Hawaii. Le sa tutongi na ole pasese ele malo. Ole almeo la tupu I ngase ia. O ua mawhainei o na whaongare Medicaid e tutongi e lisi vaenga o la tau pili I fo mai mawhanmai.
E eile li miti o whaingo le tautua o le official Medicaid I Hawaii. We are able to refer people to Hawaii under permission from CMS, but it's very restricted. First, we can only send patients to those providers that we have a contract with. Ele mawhai el mato ofisa ona refer se tangata si mai I se fale mai po se fo mai ele o yei se konkalate I lalo el mato ofisa. What we call this a provider agreement, and it's like that for all Medicaid programs. And this is to protect against fraud, waste, and abuse. Anyone who wants to provide medical services for our patients must apply to our office for a provider agreement, and we also have to vet them through the CMS database to make sure that they have not been terminated as a Medicaid provider from any other state.
Yeah,
so in Hawaii...
Who are your contract providers in Hawaii?
In Hawaii right now we only have two, Adventist Hospital and Eyesight Hawaii. We used to have Orthopedics of Hawaii, but they have closed down.
Which one?
Adventist Hospital in Kailua. It used to be called
Is that
Castle.
the Seventh-day Adventist?
Yes. They're the only ones who were willing to sign a contract with us. O le whaalawelawe, o leva na o whiangai ma le problem lea o le sueina se tato kong kalake with Queens. Ele ngalo ya Queens le tato ai ta alafu, le miliona ma le miliona tausanga. To this day, we have not been able to sign a contract with Queens because of their concern about our government's ability to pay. So our credit was damaged years ago, and that is why we are not in the state of Hawaii. And that is how I ended up getting permission to send our patients to New Zealand.
Kaiser?
Kaiser will not sign a contract with us. They were one of the first hospitals I approached because they have a network. The only way that Kaiser would be willing to bring American Samoa into their system is if they set up a Kaiser hospital in American Samoa. We are not part of their network. We have approached them. They were one of the first hospitals I approached in 2014.
Straub?
Straub will not sign a contract with us for the same reasons that Queens won't sign. They don't, ele ngalo ya lato o le lato lava popolenga o le malos o le tutongingo tato pili. So it's a credit issue. And until we find a management that is willing, or someone who is willing to convince them, the corporate office, to take a chance on us, that's how we've built this off-island referral.
Have you brought these issues up to the governor and have the governor's office address it from the executive level?
Of course, they are very well aware of the issues.
No, that's not my question. My question is, has this issue been brought to the governor so that the governor can address it himself from the executive level?
We have not done that with Straw, but the governor has been very involved with Queens. So we are right now in Queens. We have not got a contract with Queens. Queens, and we're hoping that we made very good progress this year. Provider agreement or review legal department. So we're hoping that we'll continue to work with Queens, and hopefully in the new year.
Why didn't you just tell us that when you said that there will be no contract with Queens? You would have led us to believe that there was nothing wrong. If it were not for this follow-up question, you wouldn't tell us that.
I've always been advised, sir, to just answer your questions when you ask me. So I apologize.
Who advised you that?
People, don't just answer the questions that you ask us. So
What
I
people?
will. The members of the Senate, members of the government. I'm not going to disclose.
Which member of the Senate told you to just answer a question? Which member of the Senate gave you that advice?
Well, I think my friends who are my friends, but
Which senator
I
is
don't
your
think
friend?
that. Well,
Which senator
I
is your
consider
friend you're
most of you
referring
my friends.
I'm not your friend.
Okay.
And I never would give you that kind of advice. You're lying. If a senator gave you that advice, tell us. You can't because you're lying. And I would want to know who in the government gave you that advice not to answer the senator's question directly when asked. Because this is insulting.
With all due respect, Senator, I am trying to ask your question, and I'm answering your questions exactly when you asked me.
I asked you about Queens. You only told me Queens would not have a contract because of credit issues. And in the follow-up, why didn't you accept this to the governor to address it from the executive level? Then you tell us the governor has been involved in negotiating a contract. They're reviewing your proposal. If I did not ask that follow-up question, we would have been left to understand there is nothing that can be done with Queens.
I apologize, Senator, but I thought I was answering your questions when you asked me. If you ask me a follow-up question, I will answer exactly as you've asked me.
Don't try to be clever with me. You should not sit in that seat and purposely lying to us when we ask you direct questions.
I apologize.
You better be. No, Chairman, have you drawn up a plan? If you're referring ile castle or the Adventist hospital, ile kausanga ile ngofo inga akon.
O le whainga o referrals na alu castle is about 30 talu on au mai castle tonu le network o le Plokalama.
Ang whainga mai castle tonu Plokalama.
2023.
30 patients since then?
Yes, and I'll explain why, if you want me to explain why. The reason why we only have 32 Adventists, Manatua, tusa lava pe refer mai se tangata mai le LBJ, doesn't mean they're going to be referred. They have to be accepted by an off-island provider. So itelio time e avatu castle fai mai taso elesea o ngai avatu fua, or castle will say we don't have a doctor that does this. So it's the same thing in New Zealand. Just because you are referred from LBJ does not mean a patient is going to go. Previously, LBJ alone made the referrals. But now that we have the Medicaid referral, I took it very serious to ensure to address Senator Malaipula's advice. We uphold and avoid conflicts of interest, as well as protecting the principles against fraud, waste, and abuse. There are now 4 steps that a person has to go through and get approval for in order for them to actually go on the referral. You have to be referred from LBJ, who initiates the referral. You have to be screened for eligibility. And the third most important one that people need to understand is the hospital or the doctor in Hawaii or in New Zealand must accept your case. If we do not get an acceptance, a patient does not go. So, we just started with Adventist Castle, and we realized that the services at Adventist Castle may not be as comprehensive as Queens. So we're really hoping that with continued work with Queens, we'll get a contract with Queens, very, very soon, we hope.
Who's the other facility in Hawaii that you're contracting with?
Eyesight Hawaii. We send a lot of
Eyesight?
our Eyesight, EYESIGHT. That is our ophthalmology contractor. We send a lot of our cataract and retinal detachment cases to Eyesight Hawaii.
Okay. My final question is going to be, is it your testimony that none of this $6 million is going to go to paying arrears from previous referrals to New Zealand? The New Zealand program is all paid for based on the reserves that your office did.
No, that is not correct. We have already exhausted our reserve, and we currently have 1.2 million in New Zealand dollars that we still have to pay. We believe we do have a solution. Yesterday, we were informed we have a CMS is going to help all the territories with providing a bit of a waiver for some local match. We are working on that. We just received word yesterday, but we did anticipate that we would use part of the $6 million to bring us out of arrears for not only New Zealand, but our hotel Pagoda in Hawaii. We still have an outstanding bill with them.
So how much of this $6 million is going to go to arrears, and how much is it going to go to new referrals?
We don't know yet because we just got news of the waiver yesterday. So our finance team, we're working with CMS today and tomorrow before the end of the fiscal year. We are hoping that the waiver will allow us to clear our arrears so that we don't have to tap into the $6 million. But if that can't happen, I'm estimating we'll have to use about $1 million of our FY 2025 to clear all of our arrears in Hawaii as well as in New Zealand. But I hope it doesn't come to that.
Tāsangatu lau whionga te tai komiti nei e tā pā se ripoti. Fia malmalama ato toa se tustusinga e whaeloa mai ai le whaonga ina o le 1 miliona le alo ua watu e male tongina o pili tua ia male application o le waiver lea ua whaapupula mai nei asu. Mo se malmalama ngā atili o le tātou mo te whaafitai mo le awanoa.
Tai lau whionga sentoa. O whionga satonu ia leu whaafoka pai, mina o bia lava se reporti a toa le whaonga ina le 1 miliona na le la amatanga fōu, mai lo na amatanga ia tau lava le unga. Mole i lea periodically ia e tai kuata pe tai masito. Mole, aftai, e tele leo sai, tato maota, alo foi le saunoa, sai foi whaafonga, tai foi tato muli mau. Ia, o lau whionga po mele.
Ia, whaftai lau malavu ngoa tai kaneki. Pa ia le mao ka maulunga. Ia whio mai pleskengi, malsui pleskengi. Alo whalaiwa Sandra.
Alo whalaiwa.
Se whakula o fisiri aku ia oi. Mo le criteria lenga whai mai, oi, I think ngā alua o whafo whaila o kalawai, o kusi mai fo mai ngā I ia o kou, langa o lau ngifo o fula, it's been giving me migraines.
Right.
So ngā kusi mai le fo mai ngā I to say that I need to get dental work. But ke mi kongua ngā lai ko pungi lo office. This last quarter. And that was le fia umenga. Because ele ngā wau, lai loa lai kele kanga lai mga umia sosoangi mol koka ngi. Ele kanga ko pungi lo office nga. Mo le sosoangi. Cause I know I'm up to date. Lai kongi au lau Social Security. Lai mo lau Medicare. But I le qualify out lang o ko pungi lo office. Is there any way ele ko kupus me fa peni e ko pungi lo office le ko ka mumuli so skemia o mumule la ofisini ngali tai le faton
fa tai la vai la mafionga mo ofisili o le memo mua ele na le tasi level awala e mfai ona nga va ai o tatou tangata I le polokalamo le Medicaid I mea ia tau o tonga fitinga I fai fafu e te tau lava ona refer atu o e whalmai. We cannot pay any other way. So in your case, because you were off island, number one, you were not referred, so you would not be eligible. Number two, e ai fo isi services I te tonu o le polokalama, e le anga va ai o tatou tangata, and that is dental. Dental cannot be covered off island. It has to be covered on island. The rule of the off-island medical referral, Medicaid, it's supposed to be used in your state, in the territory. All 50 states have their own Medicaid program, but you're supposed to use it in the state.
All the service that I needed,
yes,
it cannot be provided here.
Okay. That is true, but it cannot be done unless we amend the state plan to allow for dental work off island. So dental is simply not covered off island. It's not a covered off island. The state plan has to be amended to allow for us to cover any type of dental off island. So, and we can look at that, Senator, and I can have a discussion again with yourself and with that's a policy decision that we can change. If we're for love ile local match pe mafai tato officer ona cover le dental for all of our people off island. Ole tulafono lava ile Medicaid plan. If it's something that cannot be done here, but it has to be, all those services has to be in the state plan. For example, rehabilitation is not covered off island. Cancer is not covered off island. Dental is not covered off island. And that was defined by LBJ back in the years because ele mafai tato malona o ele lava se tupe. But we can definitely change that. The more local money that is provided to the Medicaid program, then we can start adding new services like dental off island. So it's a complex work that we have to do. We have to decide: do we want to cover all types of dental, or do we want to just cover only the dental works like dentures and complicated treatment that can't be made here? We can make that happen.
Ya, tai lo, fionga sento sa tele, sa loia.
Afkai ai lo fionga ke komiki mo le fonga, ka lo fa foi pe moka. Ya fa pe foi lo fionga faton, ya lo sui. Ka au manguia. O ka ua yo le lo o mai moka. Ango le fa lo mai mula ku nge maka upu ka ua lak soifua maloloinga. A ke le akula fisili moka. Ia wa kaun kia le ango o leo lo whanongo mai la ngu ka ua nge mka upu. O launga luenga le fisilingia ea. O upolenga ia o le akua pe i lo fionga le whakongo. O lau pākia ki le anga approve lua fe lua wha. 5 masinga a waka ofi le refer. Fiku leia masinga le koe o mai pākia ki kausanga ngei.
leo approve la pa ke ki leo ngo midionga o le sili mo ia ke oi pe a sha wo kupu ai le mea o oi o le whakongo ele kaunga kupu le mea lea a wha pe ke loa le kalwhengai o kaunga pa ke ki a ngai lo ofisa ia mor kausanga lea leo wha ua whalongolongo aku kai au ngei ele lava leo ngo midionga lea i lau lea whamea midionga lea leo ngo midionga lea wa avaku matching fund sfulua milionga a o le kongia ia arrears ia po pili ia lo ka o nge mai New o le foi lao ke la wa ia i loa e ako foi ka usanga nge wa umala kupe a le i umala ka usanga a pe o kulanga nga o polenga wa i men nge o le foi o ka ngofo inga mulmuli nge o la faka usanga leo la uma ma ko fo faka usanga o ala nya wa se sa ngua mai po ala nya fuanga inga ia kalfengai o le si fo i beleng mo aku le longa le mal fal mai mangu ia fal mai e umala wa ka ofi le refer oi au la fa wa fo mai le fal mai fo la ko refer le ave fafo o le ala fe so ka inga oi ma le fal mai ku so kulanga ia pe o kulanga nga leo fsida kwa ila sungal fakong po le anga fuanga mol pa ke kila pe ke sango mange au dia le kapsang fo wa le falongo pe ango fayak ele kon ke le pidi le kongia ya male ava
Faftai lava ila wa fionga mo fsita ua ma na ile fisili and if I may I want to really provide some context so I can answer more thoroughly especially given Senator's concern here about me not answering completely. Se o tamu whai atu la. O le memo mua, e le i tā ofi le matou tautua i le LBJ. Sa a whau lava le stongi ngō le tupe o le Medicaid le LBJ. Wha pe nā fo i o tātou whale mai i loto i whale there are community health centers. E le i tā ofi le tupe e alu i le DOH ma le LBJ. O le There's something that I also want to explain about my leadership of my office. Te le o whalavelave o tatu atunu ilmele ta ule healthcare. We just don't have enough. So ol mea na tupu, ol mea tonu lava na tupu i le FY 2023. Sa matal noa le la fionga ko vanga. Ole naunga ko vanga. Su se awale fisoswani tato ile mele o kanisa le referral kanisa ma le referral tato tangata ia no fumau ile oanga va ile Medicaid sa tasia la tali le fionga ko vana ele mfai en fa ma to on fa ngale tupel fetwale e referral ile mele o kanisa ma tangata no fumau pa wale awale mfai fai se tato fai pilot program fa taita inga se isue po le atonu le tupe mana o miel malo se taimi lumanai e fa usia se tato polo kalama mo le mele o kanisa ma mele o tangata no fomau o le mela na tupu le lua fe lua sutolo that's what caused the depletion of our local money that led us into 2024 and we knew that and we said that's number one. Number two, whaingata ono o ignoringa le talusanga mai whalma. Sa mata le FY 2024, ono la mātou lava fuafuanga le tupe lewa ai mātou, ia atoa le tausanga o lo iai lava le tupe. But that didn't happen because we didn't get enough sufficient budget to cover the permanent residents and the cancer that we piloted in 2023. So that did, in fact, deplete our local money that led us into 2024. But we do have a plan now. We have a proposal. We got the data we needed. We have a proposal. And we explained to LBJ, in FY 2024, whaamole mole, it's a ofi le mato referral, na ole luas fulu tangata mwhaina o le referral at any one time. To e saul se silima, to e avele silima. Well, that did not happen, and I take full responsibility for that. At any given time, we had anywhere from 50 to 80 patients in New Zealand above what we could financially support. And it was very hard for we cannot deny that. So This year, in answer to your question, po o ase fuanga o mato ofisa mo le nei tausanga fo, o te tali tonu e lava le tupe ono miliona lena au mai le fono e faa tino ai le ngaluenga i le tausanga fo. O mea fo ia la afai, we are reinforcing our policies with the LBJ referral. O lea i le amatanga o le nei kwata mua o le ali miti le numero referral le sefulu le masina se i o Januari.
Whafkai lawa i lau whionga le whakong. Kalwaya ngor kako kemi ma hawa fo isi a whionga senkoa. Au whalua inga sa wanga senkoa maisua. Mga mia di poki lau sunga chairman. I leanga kausanga kwai. Ai whafkai kele kaukua lau whionga le whakong. Ia manguia le kai au.
Whaftai.
Alo, whaftai. Eire. Saunoa, whionga sentoa. Wele. Tungan mo mau, mo taringa fasili. Ia, beesta. Ia, la whionga. Bale, ia, o whionga. Tamtua.
Whionga mo mau, el patron, Sandra, mo whaseu. Te pawala o tila na e saunga maka ua pe not every request for referral mai whalba e ad le whapela request for mo ad so lana le mela o le request le format is one of eventually ad wele e mai le pola le ad wa ya
Whaftai mo le fasili. Afa apea wale talia mai se referral mai fafo. E iai foi e tama whai mātou e ngā lulue ma le LBJ ma fo mai mai fafo. E whaile me ta o le teleconference. That's one of the first things that we do, and we're going to enforce that in the new year. E whai mua le teleconference mo tangata mai e le o talia. E whesosoani mai iai e fafo po anisi tonga whitinga mwhaina whai le tatou whal mai mo le nei tangata e le o talia ina. E tele o taimi o mena e tupu e whai referrals o tangata e vai mai ia off-island providers ma o le lato ofisili o se mele ai se ame o le mawhaina whai ele mele I le LBJ. And a lot of times that has worked successfully. And we return the referral patient back to LBJ, and sometimes the patient takes it on their own and they take themselves off-island, but unfortunately we cannot cover them. But we do telemedicine consultation with the doctors off-island to assist LBJ on how to provide treatment for our patients on island when they don't refer, and the patient goes back to LBJ.
Le chief chili Sandra, le we sa ngo bangi la pe ko fe ko nga inga ma pala mai LBJ. We do silalo ya refer maybe 10 a month. It's a critical case. It has to be transferred refer all. And Franco so you go for
Let me explain. During the suspension, ili masino o July, sa ave ile medevac o si tenetiti lima tausanga. It was a true accident. The child fell off a 2-story. Natalia Nusila, tusa lava olo yail tato aita lafu. I ona ole emergency nature, and it was a legitimate medevac. That went in July. New Zealand, we rely on New Zealand to do their due diligence and leave it to their professional, expertise in accepting medevac cases. Ma lesi fo itu langa o cases here, emergency medevacs. Ele tau fia mātou, e ave sao lave mātou New Zealand, ele fesilingie mātou, ai e iei foi I restrictions. For example, ele mwhaiona ave tangate over le tolu se lau paunga I le vaalele. That is just something that is not done. So it's an automatic denial from New Zealand. They normally do not accept stroke patients, because stroke patients, if it's not addressed within 24 hours, they consider there's no point in sending someone with a stroke. But it's too love for my acceptance. E le deny e mātou se case or referrals on medical reasons, because that is not our job. And we're not clinicals, people. We only deny a patient, pe afa ape oio se tangata e leanga va'a fo ina le sau in your national status. And, but the medical acceptance of a patient is done by the medical physicians and the doctors.
Ko ma pide pa me ki fa po nga isi a pionga i tenko. Ka tai le mo ko pe fa wa ila nga luenga. Ma ko programa. Ia e ka sia le fa mal fa maoni, fa mal le lo fo le tu. Ia fa po le ia o fa pia ke le ali si va la ke ki si va. Ia va ku so le mo la tu. Ia fa mo le tu ia ke o Sandra ma ko ofisa. Ka mo nga luenga le lo ka so ga mo.
Tai la fionga sento te ngamo sa bra. Ya. O fionga sento male pule ya. Sa no.
E fatto lungo la nganga le so no e fionga sento le il pochi lo sunga fatto. E ka u me le so un ko e fionga sento le fo la tu le nganga mo te le tao. Au te moli al mau mo fa la lo fionga te committee. Ia whaangafu ia tātou mon mau a tātou tatari li poti. Ia ma lewa a wātou li whingaro mauta. Ia e le sunga le whātonu mo whautuanga. E ala le whātinu ino ngā ruenga. Ma leisi mea o le ono milionga. Ia o le ono milionga ai o le proklama le refer. A leo le pākeki ngā lo ofisa. E se al pākeki lo ofisa e se proklama. Le ono milionga lea. Inga ia pula malamlama. Al mau nā mar whaalor tele lo whionga te committee.
Alo sa noa lo whionga se toa. Ia, ua ie le mau. A whai wa, ia, le wa whaalua ila le tātou mau. Tal tonu o tal whiangai fue me le teimi. Whaftai le on sa. Whaftai sa noa. Whaftai whautua. Le tai au mal tau. Taua. Mul whafonganga le tātou atu. Whaftai foi tātou mul mauri. Sai mul tani fisiri e le fai go fio foise ai fa ftai le o malama le a foi fa foanga ta maia ia me suel tatu watu du i vole anga i luma fa vole ripoti nai fia mena mia pe le sa reina fio se toi so yola ma to uma i fa nga ino le ono miliona na ia pe tai do ma si de pe tai kwata ba paisida Lipoti o le tau whaangai no pe onda tasareila. Ai whaaftai tere lava ne yaso. Le ua o le proklama o ngā tele. Le eisise whawhina wina la lea mta upu. O se mta upu o se proklama au ngā tele. E mena o mia tangata uma. Me le whaaftai foi. Ngarwenga ne pe on sa noatu tabaia. Ia whamanuia le tuai. Joel Faton, ya, so atu le, te pide mo so doanga mo buli, ya, tatu.
Whaftai tele o tō a whionga e tusolo o tō whina ngalo malamalama inisium tā upu sa whisilingia masasaa iai o tō whina ngalo le nei tai au. Whamaloto whā, mamao ma le whautatanga loloto. O te whamalulu atu pe a le i whamalia ina o tō whina ngalo ini au tali. O lo lava loto ina ia o ngalo uola mo si o tātou malo ma o tātou tangata. Ma ngalo mai fo i se vai o le nei au auna. A ia sanga whamanuia le atua i lawa whionga i le taitai komiti, ma le malu al komiti o le nei maota. Whaapea o tō a whionga i senatua. Whaftai tele mo whautuanga ma tima inga o tu uina mai mo au malene ofisa. Ia soifua ma ia manuia le tatou so.
Tai, manuia lava.